reaction now from a trade union on the long lines of healthcare workers who are waiting for COVID-19 vaccines. I'm joined now by Nehawu's Johannesburg Secretary, Mr. Mzikayise Tshontshi. A very good afternoon to you, Mr. Tshontshi. Your reaction as Nehawu on nurses, specifically as we've experienced at the Charlotte Maxeke Hospital, who have been turned back while they were trying to get their vaccinations. Could this have been averted?
Good afternoon to you and your viewers. We find this to be a very unfortunate situation, because it shows us that Charlotte Maxeke was not ready to resume the vaccination. And the reason we're saying that is because information was circulated that people must come to do vaccination, only to be told when they arrive that the hospital actually does not have sufficient vaccines for everybody. And you have to ask yourself, why did they tell people to come if they were not ready to resume this program?
What we're hearing, Mr. Tshontshi, specifically, and we heard this on the ground now from the healthcare workers who are outside the Durban hospital at St. Augustine's, the situation in some cases is that vouchers were issued, and in other instances, vouchers as well as dates and times were issued as to when the healthcare workers need to be at a particular place. How could this system, do you believe, have been streamlined to ensure that there's no confusion there in communication?
One of the problems for us is that the communication that was done, for instance, in Charlotte Maxeke, as you are saying that vouchers were issued, some of the workers that came today didn't have the vouchers, but they were invited to come. And for us, that was a glitch, if you can call it that.
And who invited them? And who invited them, Mr. Tshontshi?
According to the information that we have, the hospital invited them, communicated with the employers that ought to have brought them for vaccination, that they are ready for the vaccination, only for workers to be turned away because there's no sufficient vaccines.
So if that is the case, then what is the value of having the phone registration app process that everybody who wants to get vaccinated needs to engage in? How does that play into the process and the dynamic of the registration process?
For us, it should have made the process very simple. It should have made it very easy to do. But when the systems are not working properly, as in Charlotte Maxeke, you have a situation where something that is supposed to be assisting is unable to do what it ought to be doing. And from where we are standing, the miscommunication that took place is to blame for this. And unfortunately, we blame the hospital management for this miscommunication.
What role can Nehawu play in a situation like this to try and bring order, to try and make the system and the process more seamless?
One of our responsibilities is to engage the employer on a number of issues, including this one. And our job is to make sure that there's seamlessness on issues of this nature. And unfortunately, one of the problems that we have at Charlotte Maxeke, you have an employer that communicates past stakeholders.
Are you still with us, sir? All right.
We find ourselves in a situation where we are not being consulted on a number of issues. We have even sought to have a meeting with the MEC for health, and that meeting is still outstanding, because we believe that had there been proper communication or consultation among ourselves, some of these things can be avoided.
Perhaps let's take our focus off Charlotte Maxeke just for a while. Other hospitals within the Johannesburg precinct and workers from various hospitals. How have they been serviced, do you believe? Is there equitable access for all health workers across the board?
At the present moment, the only problem that has been reported to us is with Charlotte Maxeke. At Chris Hani Baragwanath hospitals, there are long queues, but we don't have a report that says there's a crisis. The only crisis we have is at Charlotte Maxeke at the moment.
So what message would you give to your members and to health workers at large about this process? Would you say to them, do not go unless you've received a date? Would you say to them, do not go unless you have a voucher? What would you say?
First and foremost, we encourage all of our members to make sure that they get vaccinated for COVID-19. But as a matter of fact, workers must make sure that they've got all the relevant information before they can go get themselves vaccinated. So it is important that they must wait until they are informed that they must appear and make themselves available for vaccination. And that is our message. But at the core of the message, all of us must get vaccinated.
So you say they need to wait until they get communication. Who is this communication supposed to be coming from? Which is the authentic voice?
It's supposed to come from the Department of Health, Gauteng Department of Health. They are the ones that are supposed to communicate with all those that are registered on the system as to when they must avail themselves for vaccination.
Well, thank you very much, Mr. Mzikayise Tshontshi, on that update and views coming in from Nehawu. He is the secretary for the Johannesburg chapter of Nehawu. Certainly a bit of a worrying process there as far as logistics are concerned with the vaccination process for health care workers, and we'll continue monitoring progress in that situation.